To establish a good doctor and patient relationship, it is important that you get a complete history and do a thorough physical examination in order to properly assess and diagnose a patient. Say, for example, a patient comes into your clinic with a chief complaint of fever. What will be your approach in diagnosis? First, you must get a complete history of present illness. Ask about the onset of the fever, the duration, and the temporal pattern. You can also ask for aggravating, relieving, and other accompanying symptoms. The patient tells you that aside from fever, she suddenly cannot hear that well on both ears. She also has clogged nose and sore throat. After taking her primary history, you can also ask for her past medical history, personal social history and other pertinent information that might help. Now, how should you proceed? First, do a complete ear exam. Inspect whether left and right ears are of equal size and shape. Inspect for any skin lesion. Palpate the auricle, the mastoid process, and press the tragus inward toward the ear canal. Next, do an otoscopy. Ask patient to tip head towards the opposite shoulder. With the other hand, straighten the ear canal upward and backward. Gently insert the otoscope in the external auditory canal, carefully advancing until tympaic membrane is seen. Describe the tympaic membrane as to its color, integrity, position, transparency, and landmarks. You can also do auditory screening tests like the CAFRAST. Produce sound by rubbing the thumb across your finger. Start at 10 inches. Ask patient if she can hear the sound. If not, move your fingers closer. If she can hear bilaterally, then testing is complete. If a patient has hearing loss, you can do tuning fork tests. First is Weber test. Strike the tuning fork and place it firmly on the patient's forehead. Ask where the sound is heard. If at midline, then hearing is normal. Another test is the retest. Strike tuning fork and place it against patient's mastoid process. Ask patient to tell when the buzzing sound stops. Then move the vibrating tuning fork near the auditory meatus. Ask patient to tell when the buzzing stops. Note the duration of both. Do it on the other side as well. Interpret the results. Next is the nose exam. Visually inspect and palpate the nose for any deformity. Evaluate patency of each nostril by pressing one side and asking the patient to stiff. Inspect internal nose by tipping the head back, placing the thumb against the tip of the nose and looking through the nares with a pen light. Note any septal deviation or perforation. Inspect the inferior and middle turbinates. Palpate the frontal sinuses for any tenderness. Palpate the maxillary sinuses next. With the use of a pen light, transilluminate the frontal sinuses and observe for a glow above the eye. Next, transilluminate the maxillary sinuses and observe for any glow in the hard palate. Next is the throat exam. Inspect and palpate the outer structures of the oral cavity. Assess for malocclusio. Ask patient to open and shut jaw and expose teeth. Move the jaw from side to side. Inspect and palpate the lips for symmetry and any lesion. Inspect the dorsal tongue and the buccal mucosa. Note for the symmetry of the uvula when tongue is protruded. Examine the hard palate with patient's head tilted backwards. Inspect posterior pharynx. Depress with a tongue blade. Inspect the mucosa and tongue by asking the patient to move tongue side to side and up and down. Inspect the anterior neck area. Check if trachea is in midline. Ask patient to hold head in a relaxed position. Inspect and palpate the neck laterally and check for any deviation or bulge. Make sure to palpate both sides. For the lymphatic areas, follow the sequence: preauricular, postauricular, occipital, tosellar, submaxillary, submental, superficial cervical chain, posterior cervical chain, deep cervical chain, and supraclavicular. Remember that in any clinical setting, nothing is more important than a good history taking and physical examination.